swelling and inflammation is what you're creating with blood flow restriction. And so in elderly people and injured individuals who can't lift very heavy, you can get almost like the same gains at 80% of your max rep at only like 20 to 30%, but doing blood flow restriction at the same time. So it's like, it's a good hack for the elderly or for anyone who's coming off of an injury, because it allows you to basically get good gains. And it's even good for people who are bedridden. It actually reduces muscle atrophy, even if you're not able to exercise, just simply putting on the devices and letting them, basically constrict the muscle for 1 to 2 minutes and then release and do multiple cycles of that.
Well, James, welcome. Thanks for being here. Hang on just a second. I'm going to grab something. I'll be right back.
Okay.
So I wanted to grab this guy. So you're familiar with that. It's in this book you just wrote. That's behind you too. So anyway, I was thumbing through it. I haven't had a chance to read the whole thing yet because it's quite a big book, but it was quite interesting. So let me, before we get into that stuff, because I know you want to talk, and I'm pretty excited about it because obviously I'm somebody that's interested in athletic performance for sure. Remind folks who you are for those that aren't familiar with you, because I know you've written I think this is like your 4th book or something like that, if I'm not mistaken. So let folks know who you are, James.
Sure. It's Dr. James DiNicolantonio. I'm a doctor of pharmacy, cardiovascular research scientist. Been publishing on nutrition for over a decade. And as you said, I've written several books. This is my 6th book. This time sort of translating some of the information from my first book, The Salt Fix, which was more on cardiovascular effects of salt, to athletic performance.
Yeah, there's so a 6th book, okay, and since because the Salt Fix, so you've been pretty prolific. It's got to be like 1 a year or something like that, if I'm not mistaken. If you've written 6 or something like that, so that's pretty good. Congratulations. I wrote 1, and that was enough for me. I think I'm not much of an author, but anyway, so let's talk about the premise of the book. So this is basically basically be a better athlete, be a champion. What prompted you to write this one?
Yeah, I'm working with a lot of UFC fighters, sort of, translating that knowledge into something comprehensive was something I wanted to do. And really, no one has really written a lot on hydration and really like study supporting how it should be dosed. And so really that was probably the biggest factor why I wanted to write this book, is I think a lot of people could benefit from it.
Yeah, unless don't think there's a couple of things, and again, like I said, I haven't a chance to read the whole thing, but I basically looked through it. And one of the things that I think I saw you talking about it, and maybe we can get into this first, is kind of a weird thing. We've got this glabrous skin, on our palms and our feet and our forehead, which you point out in the book, and you talk about the thermal regulation that occurs, you get overheated. And by cooling the palms of your hand, which, I wouldn't think about that. I mean, it's like, it's my core temperature is hot. Why not just cool my abdomen or something like that? But cooling your palms, obviously your feet are harder to cool. But talk about that a little bit. What's going on with that sort of thing and the athletic performance by either heating? Because I'll be in the garage and it's freezing cold out, and I'll warm my hands up. I'm sitting my hands in front of the heater before I do some deadlifts. But what's going on with the skin and the palms and hands and the soles of the feet and the head, and how does that help us?
Yeah. So, I mean, what's really interesting is that it can be really cold out, but if you have your face covered, you have your hands covered and your feet covered, you're going to be actually pretty warm, even if you're completely bare chested, you don't have anything on your legs. And that's because we both absorb and dump heat off of those glabrous skin areas, the palms of the hands, bottoms of the feet, and basically the cheeks and the forehead, a little bit in the ears too. They contain these special blood vessels called AVAs, arteriovenous anastomoses. And essentially they can dilate really well. So they basically can open up, and you can bring in a lot of cold really quickly. It bypasses the capillaries directly, and it basically brings cool right from the venous system right to the arterial system. That's why it cools your core body temperature off so quickly.
Yeah, so interesting. So the normal scenario would be, large artery to arterial, the smaller to get to capillaries, and then they go up to the venules and the veins all the way on up to the larger, the vena cava eventually. And in this case, we're just skipping the smaller parts and going directly from the larger vessels, the somewhat larger vessels. So that's kind of a neat thing. I didn't realize that. Maybe I probably, yeah, I'm sure I heard of that, but I didn't really, haven't paid attention to that stuff in many, many years. So practically, how does that work? Like you mentioned, if you're like, because not, you can't cool your hands off easily on something, but if you're doing rounds of something, like I'll do a lot of training while I do sprint intervals, and I've got a minute rest, so I could be cooling my hands off if I'm overheated. Now, if I'm not overheated, it doesn't do me any good. Is that how that works?
Yeah. So, I mean, well, ideally, water is going to cool you off basically 2 to 3 times quicker than air. So, if you could have cold water and you could just place your hands or the bottoms of your feet into cold water and you only have a minute, that's plenty of time to decrease core body temperature.
And so, I mean, has there been studies on that? Can you like see a drop in 3 degrees temperature by doing that for a minute? What is it? What do the numbers look like around that?
Yeah. So, most of the studies that have done this have actually, I mean, there have been some studies looking at, let's say, in between doing bench presses and in between like doing pull ups. And essentially, you can increase the number of repetitions anywhere from 40% to 140%, which, as you know, that's tremendous, right? Like, if you can only, let's say you can only do 10 pull ups, now you can do anywhere from like 14 to 20 just by cooling in between rounds. Essentially, the idea is to drop core body temperature by about a half a degree Fahrenheit. So you don't have to actually drop core body temperature too much to see benefits. And a lot of the studies too have actually tested pre-cooling methods. So actually getting ahead of the problem. So either using glabrous skin cooling or actually going into a cool bath. Not, you don't want to go into a cold bath because that'll close the AVAs if it's too cold. So anything 59 degrees Fahrenheit or less is probably too cold. Ideally, if you're before competition where heating up is a problem, getting into like a cool bath, like starting at maybe 84 degrees Fahrenheit and then slowly going down to 74 or 64. And you do that for just 30 to 60 minutes. And the studies have looked at basically rectal temperatures, and that'll drop it to half a degree within 30 to 60 minutes.
Yeah, I mean, imagine the poor guys who are doing these temperatures. They got to have a probe stuck up their butt so they can measure their core body temperature while they're doing these things. But it's so like I'm just envisioning, how long. So if let's say I'm doing a jujitsu competition, which I plan on doing, and I might have maybe half an hour, maybe 15 minutes, maybe an hour between a match, depending on how the tournaments run. And you've got, let's say I can just buckets of cold water. I can just drop my hands in. I mean, without that, how long does it take me to cool down? Let's say I do a match at 6, 7 minutes. I'm sweating. I'm hot. How long is it going to take me normally to reach normal body temperature? And how much more rapidly could I drop it with cooling my palms and feet or something like that?
Okay, so basically, cooling glabrous skin is twice as effective at cooling the body down. So you're going to get to your baseline core body temperature twice as fast.
Yeah.
Now, after obviously it depends on how strenuous and how hot you get, and how good you are at dumping heat. But usually your core body temperature will probably come back to normal. After maybe 5 to 10 minutes. You should be back to baseline. But so even cooling down with, let's say, cold packs, and you want the more glabrous skin you can use, the better. So if you can do both palms and bottoms of the feet at the same time, or even the face too, is going to cool you off much quicker than just one palm. But even just like 1 or 2 minutes of doing this can definitely decrease core body temperature. You might not get a full half a degree, but it will notch it down.
Yeah, I mean, I can remember. I mean, this has to have been obviously this has been known for, I would assume, for a while, because I can remember as a kid watching boxing matches, and often between rounds they're sticking a wet towel on somebody's forehead. I mean, they've been doing that for I don't know how many years, 50 years or more probably. Is that where that came from?
Partially, I think a lot of it comes from the military trying to figuring out how to cool off like Marines in the heat in the desert, and especially because they're fully clothed. So figuring that out, like figuring out ways to cool the palms to do that was partly sort of where some of that research comes from, and animal studies too. How animals in the desert are able to cool off so well with the large ears and large glabrous skin to dump heat. A lot of that comes from animal studies too.
Yeah, and boxers, obviously they got gloves on. They're not going to be able to take their gloves off around rounds because they had their hands taped and all that stuff. So it's not practical. So the only actual forehead's really the only practical area they have. So how about the MMA fighters? Are they doing that between rounds? Because usually I think it's a minute rest between rounds, if I'm not mistaken. How are
Yep.
they? How are they dealing with that? If you said you work with some of those guys, or are they doing that?
So if they work with me, they are. But previously, you'll see a lot of UFC fighters or coaches putting ice on the back of their neck, or on the chest and the back at the same time, right? And that just doesn't really work to cool the body off. So if it's like a non-UFC fight, you can actually use water in between rounds, in like basically use your feet in the cool water to cool down core body temperature. I don't know if the UFC actually allows the water, but they definitely allow cold packs and ice packs on the foreheads, the cheeks, because if you do that simultaneously, that is an area obviously that you can cool in between rounds.
Yeah, I'm just wondering. I mean, I'm just wondering why they wouldn't allow water on the feet. It doesn't seem like it would be anyway. Interesting.
I think
So
because you if you bring in water into the octagon,
pretty slippery.
yeah, exactly, you could slip on it.
You got it. Hydration. So I know you've been a champion of salt and trying to disabuse people of the notion that salt is causing everybody to have high blood pressure and whatnot. I know you wrote the book on that, The Salt Fix. It was quite interesting. How does salt play a role, or I guess more specifically, hydration to be more correct? How does hydration work with the athlete? What are we doing? I know there's people talking about it. Tim Noakes, Noakes wrote a book talking about overhydration and sodium dilution. We get this hyponatremia effect, and people have gotten sick from that. So how do we? What's the current state of hydration with regard to athletes? And I'm sure it depends on the sport and on and on. But what do you think about that?
Yeah, I mean, a lot of studies show, especially with like jujitsu, judo, wrestlers, up to 90% of athletes before competition are actually dehydrated. So it's a huge problem. And really, what hydrating is all about is pre-hydrating, because once you start actually doing vigorous exercise, gastric emptying dramatically drops. So water and fluids and whatever you're trying to put in the system just sits in the stomach, and that can actually decrease athletic performance. So a lot of people drink water before or during competition. That's like the one of the worst things you can do. It can actually decrease vigorous exercise performance if you drink too much water while performing. And what the salt solutions are doing is to getting ahead of the problem. And the main problem is to drop in blood volume, because blood now has to flow away from the heart towards working skeletal muscle and towards the skin to dump heat. So you have competition between blood flow. And so there's basically an 8 to 10% drop in blood volume within 5 minutes of vigorous exercise because of this. So if you can take the appropriate salt solutions 90 minutes before competition or exercise, you can increase blood volume if it gets this concentration correctly by 8 to 10% and prevent that drop in blood volume. And here's the key. When your blood is now flowing away from the heart towards working skeletal muscle, towards the skin, the body is going to increase heart rate to try and maintain cardiac output. So myocardial oxygen demand skyrockets. But if you can boost blood volume before this happens, heart rate will actually be 9 to 10 beats per minute lower with preloading with salt and fluids.
Yeah, and so I remember you talking to me about this several years ago, and we talked about salt loading, and I do that pretty routinely. Particularly if I'm going into a vigorous competition, I'll take some sort of salt or electrolyte solution, and a bunch of water, and hydrated muscles tend to work more efficiently as well. And then of course, if you're like you said, you're keeping on top of your blood volume. So the average person, 5 to 6 liters blood volume. I probably have more since I'm a bigger guy, most likely probably closer to 7 or 8, something like that. But how do we, so 8 to 10% of that, how does that translate? What does it look like in practical terms? Let's say the average size person, what are they going to need to do?
Okay. Yeah, you're right. The average woman is going to have 4 liters of blood. The average adult man is going to have 5. Now, the biggest adaptation to exercise is actually expansion of baseline blood volume. So, in elite athletes, they'll have 7 liters. In really elite rowers, they'll have 9, maybe even 10 liters of blood. So, you're basically hacking the best adaptive mechanism to exercise. That's boosting blood volume. So, if you have 5 liters of blood and you're boosting it by 10%, right, you've just gained 500 mLs, essentially like 0.5 liters. So that's basically what you're looking at in terms of quantitatively how much you're expanding blood volume.
Yeah, so half a liter, and I'm thinking easily I drink that much, during around exercise without a doubt. Um, but the other thing, oxygen carrying capacity is dependent upon red cells, and so when you're just expanding the fluid volume, you're obviously not expanding the red cell mass. In fact, you're decreasing the concentration. So how does that work with just the fluid expansion and not the red cell expansion?
Yeah, that was actually one of the potential concerns before a lot of the data came out that okay, will just expanding blood volume improve VO2 max will actually lead to clinical benefits in regarding power output, increase in endurance, and it didn't inhibit it at all. So power output is dramatically increased. So to give you an example, um, in a 15-minute time trial, people who preloaded with salt and fluids were actually able to cycle an entire kilometer more in that 15-minute time limit, which is a tremendous increase in power output. That's like 10% increase in power output. So there's no drop in power output. There's a dramatic increase. And then you increase the amount of time you can vigorously exercise by anywhere from 25 to 52%, which is really crazy when you think about how long that is. So in cyclists vigorously cycling, they could only do it for 40 minutes. But once they preload with salt and fluids, they could actually go 61 minutes at that time. So it's a 52% boost in how long they could cycle vigorously in the heat.
I've seen some concern around, like for marathon runners. In fact, there's some marathon runners that they lose a lot of weight during their run. They may lose 10, 12, 15 pounds, some of these guys. And because of their lower body weight, they are able to, push, their strength to weight ratio relatively goes up, and they're able to do better with less weight. Is there a point? Is there some sports where being waterlogged is going to be a net deficit relative to being lighter? I mean, yeah, as time goes on, like these long ultra marathon events.
Yeah. So I would say I've never seen a scenario where preloading with salt and fluids is not going to improve performance. And that's because you have the primary, at least and certainly with vigorous exercise and even moderate intensity exercise. You're probably not going to see any benefit with people walking because a decrease in blood volume isn't a main issue in that scenario. But I don't see where loading the body with, let's say, half a liter of fluid, where that increase in weight is actually going to inhibit performance. Um, but it's possible in like a really short sprint, maybe if you're that a little bit heavier, that much. But I don't know if the benefits would outweigh that small increase in weight.
Let's talk about another topic that has gotten a lot of press recently, and people ask me about it. I don't have any experience with this, just to be to put it out there. But you talk about blood flow restriction. That's been something that I've seen a lot of people utilize. What are we trying to accomplish with blood flow restriction? Does it work? How does it work? Who would benefit from it? And maybe just kind of give a summary on that stuff.
It definitely works. It's essentially kind of mimicking exercise. You're basically constricting basically venous flow outward. So there's swelling and inflammation is what you're creating with blood flow restriction. And so in elderly people and injured individuals who can't lift very heavy, you can get almost like the same gains at 80% of your max rep at only like 20 to 30%, but doing blood flow restriction at the same time. So it's a good hack for the elderly or for anyone who's coming off of an injury because it allows you to basically get good gains, and it's even good for people who are bedridden. It actually reduces muscle atrophy, even if you're not able to exercise, just simply putting on the devices and letting them, basically constrict the muscle for 1 to 2 minutes and then release and do multiple cycles of that.
Interesting. And is that something that anybody has? I mean, I see it in the context of building muscle mostly is what we see. There was a when I was competing heavily in rowing. I know some guys were doing this. I don't even know what they call it, but they would basically go all out, and then they would not. They would just kind of sit there so that all the metabolites from exercise, the local tissue would have to clear rather than instead of walking around, cooling around and dispersing this stuff, the local tissue would get more effective at utilizing those catabolites or metabolites. and that would improve performance somehow. Is blood flow restriction doing something similar? Because you're trapping, you're inhibiting venous return
Yeah.
with some of that. So what's actually going on physically or at the
Yeah,
cellular level?
that's exactly what it's doing. It's inhibiting of venous flow. It's moderately inhibiting arterial flow, maybe by 40%. So there's some restriction there, and it's there to increase edema and inflammation, and sort of like to mimic the stress of, let's say, exercising to a point of failure. Is pretty much what it's mimicking.
Okay, let me ask you about. I'm sure you touch on this in the book. I haven't seen that, but I can't imagine you don't. I mean, do you talk about creatine at all? I mean, that's been. So I just saw a recent review article on that and talking about it seems to benefit young, healthy males, but older guys it didn't seem to benefit as much. Or is there some new updates on creatine as a performance?
I mean, the data on creatine's been out there for a long time in regards to muscle protein synthesis and strength, and it's definitely probably the best evidence-based supplement for that. But really, the new data is on cognition, that it improves even in people with dementia, particularly vegetarians, because they're relying on the synthesis of creatine, which is certainly not optimal. But yeah, anywhere from like 3 to 5 grams per day is really seems to be optimal, not just for muscle protein synthesis, but also for cognition.
Let me ask you about just, well, this is one thing I think I saw you in the book. You were talking about potassium being an issue, and I know people, you would say that people on, say, a meat-based diet might run into potassium problems, and therefore we should add some sort of potassium to our diet somehow. What are the thoughts on that?
Yeah, so Shawn, this is really interesting. It's not necessarily potassium. I think on an animal-based diet, you get pretty good potassium. The one problem with the carnivore diet is that the kidneys do have a limited capacity to excrete acid until some is retained. So we know this from metabolic studies in the 1930s. Basically, you can get rid of about 40 to 70 milliequivalents of acid. And once you start going above that, for every 2.5 milliequivalents, you hold on to one. And so the body has to breathe it out. But in order to breathe out a milliequivalent of acid, you have to lose a bicarbonate. So there is a potential issue, and I don't know if you've ever had your serum bicarbonate tested or not, that a carnivore diet may cause low bicarbonate levels. And I've had some top tier carnivores send me their serum bicarbs, and they were low. They were probably around 23. So consuming some type of bicarbonate forming substance, I do think is beneficial. Now, that doesn't have to be plants. You can get that through mineral waters. You can get that through potassium bicarbonate, sodium bicarbonate. I don't know if you've ever had your serum bicarb tested or not.
No, I haven't. I was, it's kind of interesting because I know as a performance enhancer, some people were taking in, basically baking soda, or baking powder,
Yeah.
whatever. And,
Yep.
the problem is just bloating. And it can be very, problematic with GI. And so I played with that for a day or two. And I was just like, oh, it's like my guts were hurting and stuff like that. But no, I have not tested my bicarb level. It'd be interesting to see. And I think, I guess the acid that we would be concerned about would probably be sulfuric acid. I mean, based on the sulfur containing amino acids that tend to be heavier in meat. Is that a fair thought on that?
Yeah, it is. It is a sulfuric acid. You can only excrete a very, very little bit of that as pure sulfuric acid. It ends up actually dissociating into a negatively charged sulfate, which then pulls positively charged minerals to get rid of the negatively charged sulfate because you can't breathe out sulfate. So that's really potentially why you just want to make sure mineral intake is good, magnesium, potassium, sodium, because that'll help get rid of the sulfate from the sulfuric acid that you get through animal foods.
You talk about, there's all kinds of, well, I mean, these things are interesting to me, but I mean, and some of it I have control over, some of it doesn't. I don't live at high altitude. I live basically at sea level here, or pretty close to it. But, as far as regards to, hyperbaric training, hypoxic states, there was a craze where everybody's wearing these oxygen restriction masks. What are your thoughts around, oxygen levels and altitude and those types of things?
Yeah, the main goal for high altitude training is to kind of touches on what you had mentioned previously, and that is to increase red blood cell count, hemoglobin, things like that, which it does. It basically increases red cell volume by like 80%. If you're at, I want to say it's like 4,000 feet or higher elevation will really increase red blood cell volume. And so this is like your sort of non-doping way. This is your non-erythropoietin way to boost red blood cell count training at altitude. And really, if you can live at altitude for the entire training camp, and then you fight at obviously, a normal elevation, you're going to have a huge advantage because you're going to have so many more red blood cells, and you're going to be able to deliver oxygen so much better to tissue.
Yeah, and there's a concept of like it's like sleep at high altitude and train at low altitude has been something that some people utilize. Is there some merit to that? Is it still the thought?
I mean, the reason why they say train at lower altitude is because it takes a while to adapt and it's difficult to train at high altitude. So really, ideally, if you can live at high altitude at first and become accustomed and then start training at high altitude as well, and you're adding living there as well, is going to be much better than dropping and training at low altitude. But your training will suffer at first until you adapt.
What about, as far as, let's just talk about some general things. Protein requirements for athletes. I mean, if you look at guys, Stu Phillips, Don Layman, 1.2 to 1.6 grams per kilo as a baseline, and then some athletes are benefiting from higher 2.2, 2.6, something like that. Where do you put protein at for athletes?
Yeah, I think most of the data is about a pound for every pound you weigh, about 1 gram of protein is a really good estimate. That's the 2.2 grams per kilogram of body weight, which I think I like to be at the higher end versus, yes, there are some studies that 1.6 may max your muscle protein synthesis, but the higher protein you go, especially if you're trying to maintain caloric intake or be on a moderately restricted caloric intake, is going to be better in regards to less muscle loss.
Yeah, I mean, yeah, I mean, we've certainly seen that if we're going into a deficit, you want to maintain muscle, then the protein needs to go up. And I think there's a number of studies that show that. There was recently a study, maybe you saw this, Jason, maybe I can't remember who, Jason Whitaker, I think is the author. He actually contacted me to say that the media has misconstrued his study tremendously, but it just came out looking at low carb diets, higher protein, and testosterone production. And the conclusion, it was over 35% of your calories come from protein. Saw a lower, I think it was fasting testosterone or morning testosterone. And then, of course, the media turned that into eating meat makes you infertile, which is, obviously just a complete misrepresentation of the science. And the author says so. But are you concerned about going too high on protein? And again, when you talk about percentages, it doesn't really take into account body weight. I think it's probably more effective to talk about in terms of lean body mass, perhaps. But any
Yeah.
concerns with too much protein, and again, too much is always it's a tautological term. Too much of anything, you've already defined it as bad. But do you find an upper limit that's a problem?
So, I mean, just the level set, I follow an animal-based diet. I probably eat about 150 grams of protein, maybe 200, and I weigh about 160. And I don't know, my body fat's probably like, it's not a lot. I don't have a ton of body fat, maybe 8%. So I think that's a good target. Like, I try to target 1 gram of protein per pound of body weight. And of course, yes, the leaner you are, the more muscular you are, you want to have more protein. I don't have a concern with really kidney damage or anything like that that's been sort of put out there. The only concern is the potential buildup of acid and the depletion of bicarbonate. So what I do is sometimes I'll just take sodium citrate. So citrate doesn't affect your stomach acid. So a lot of times I'll just take 2 or 3 grams of sodium citrate with each meal. And I've noticed that if my pH on my urine test is low, meaning acidic, the sodium citrate will just wipe that out.
And the sodium citrate you just get, that's just I guess a supplement you get over the counter somewhere.
I just order it from bulk supplements. Now,
Yeah.
typically it doesn't ever really hurt my stomach because I take it with some carbohydrate. That's technically how you're supposed to take it. I don't know how it would be with just like animal foods, but probably 1 or 2 grams shouldn't be too bad.
Yeah, I wouldn't see the problem. And I see, I mean, again, I'm thumbing through your book here, James, just to look at topics to chat on. And again, you touched on mTOR, and we've heard a lot from particularly people that are promoting kind of low protein diets. Some of the plant-based people saying that guys like David Sinclair, Walter Longo, protein is bad for us, and therefore we should sort of eat a very low amount so we don't stimulate mTOR and shorten our lifespan or lead to cancer due to growth, the growth sort of things. What is your thought on mTOR? Because I often get this question. Do you have any thoughts on the mTOR being bad, or is it contextual? Which is probably, obviously that's probably the truth to it. But go ahead.
If it's just chronically activated for the whole day, that's bad, aka insulin resistance. If you activate it with meat, that's good. You eat some meat after working out, you acutely activate mTOR, you get your spike in that. That's good. It's going to help with muscle protein synthesis. So you want spikes of mTOR. You want to consume animal foods to do that. Someone had a question about chronically low potassium. Obviously, I can't give medical advice. Potassium is mostly controlled by magnesium. So if you have a constant, someone was asking like, what causes constant low potassium levels? Could be low magnesium, could actually be not enough salt, since salt actually controls magnesium as well. And it could be just too much acid in the body, which tends to push magnesium or potassium, may deplete potassium too.
Yeah, I mean, the acid, because you talk about, well, I mean, if we look back, to the studies on these carnivore folks, back to the 1920s, when we have Stefansson and his buddy Carson Anderson, everything was fine except their urine acid load was higher, which is consistent with what you say. You're eating a lot more acid-based diet. But I mean, the serum, blood serum, we're going to tightly regulate our pH between 7.35 and 7.45. If you deviate much from that, you basically end up pretty sick and dead. If you go below 7, you're like dead. So we have this very tight control, metabolic controls through our oxygen, our lungs, our kidneys, the bicarbonate system. They control serum pH. I assume cellular pH is probably well controlled as well, and it's just the urine. How do we? I guess I'm just wondering. You're saying that the urine pH being low is problematic in some way. What exactly is going on there? How does it affect us overall?
Yeah, that's a good question. So, okay, the blood is better at buffering acid actually than the cell and the interstitial fluid, because the proteins in blood can actually help to offset some of the acid. So albumin, things like that aren't found in the cell or in the interstitial fluid. So you're right that the body's good at trying to maintain a normal blood pH. It starts off at about 7.43. By the time you're at 7.36, you have had probably chronic metabolic acidosis for a long time, because the body, like you said, like the blood, it just fights and is really good, but it's really the cells in the interstitial fluid are not as good, and that can potentially lead to some problems with insulin sensitivity. It's not it's not like it's like gonna really have harmful effects in like 1 or 2 years. I think it's more like, decades that it can be a problem. So that's why I started adding in some sodium citrate to my diet. Because, okay, so here's how acid works in the body. Again, kidneys have a limited capacity before some is retained, and then you have to breathe it out. And then in order to breathe out one molecule of acid, you lose one bicarbonate molecule. So your bicarbonate stores go down. And the sulfate can deplete the positively charged minerals that are coming from the animal foods. So you just need to offset you got to make sure you have a good sodium, potassium, magnesium intake. And then if you can, mineral waters that either contain bicarbonate or sodium citrate should help to reduce that acid load.
Interesting. So mineral water, well, I guess there's a lot of mineral waters out there. Any that are better than others? I know you're probably not.
Yeah, I mean, Gerolsteiner is going to be really good, but you got to be careful because you can fizz it out if it's super fizzy. So like, I have like a coffee blender. I'll just like pour it out and I'll just blend the water and just fizz it completely out so I don't get bloating. And then you want to drink it like 30 minutes before a meal. You don't want to consume it within 2 or 3 hours of eating, because it contains bicarbonate and it's fizzy. So you don't want to mess up digestion. But that's probably one of the better mineral waters that also has good amounts of bicarbonate.
Got it. Okay. So there's just a couple questions I'm seeing from the folks. I just address those real quick, if you don't mind, James. Somebody's asking about, do we have a cause for constantly having low potassium? I guess you maybe know somebody that's in a chronic low potassium state. I know there's a number of reasons, but any major thoughts on that?
Yeah, the most common is low magnesium because low magnesium typically presents as low potassium because magnesium is needed to keep potassium in the cell. So if you have low potassium, that's usually low magnesium, but it can also be low salt and it can be too much acid as well.
Okay, another question is about cramping, and this is a kind of the opposite. It's like some people are getting cramping with the addition of salt, and they finally do better with removing that. Any thoughts around cramp? I know cramping is such a hard topic because it's hard to study. I mean, it's not, you can't like do a randomized control trial and make these people cramp and these not. It's kind of really random when it seems to occur. What are your thoughts in general around cramping?
So yeah, totally depends on the situation. So if it is exercise induced cramping, the two main causes are one, just overtraining, and the second is salt loss. It's been proven many studies that taking salt tablets with the appropriate amount of fluid will dramatically reduce cramps on exercise. Regular cramping can be due to a number of electrolyte deficiencies: calcium, potassium, magnesium, or sodium. Now, if someone's getting more cramps by upping their salt intake, um, I don't know. That could be just not enough fluid matching the salt, and then you're sort of messing up your own internal fluid balance, and that can then precipitate a cramp because cramping typically is the constriction of the interstitial fluid and the contraction of basically the nerve endings, which can cause muscle cramps. So when you expand interstitial fluid with the appropriate amounts of salt and fluid, you're going to reduce cramps because you've expanded interstitial fluid. You're not going to get mechanical compression on the nerve endings. But if you mess up the salt ratio, if you just do high doses of salt and not enough fluid, then what you're going to do is you're going to pull water out of the cell to drop the high salt levels. And that's why if someone just takes too much salt with not enough fluid, it may induce a muscle cramp.
Interesting. Okay, and so there's another question here about inositol being utilized. I guess apparently you recommended it in the past. Thoughts on that? What is it doing? How does it help with amino acid absorption?
Yep. So when insulin docks on its receptor, um, it releases these inositol compounds. That's actually how insulin works. Insulin doesn't actually have a direct effect. It releases inositol compounds, phosphoinositols, and a bunch of other ones, INS2. And
Nope, looks like he froze up. Anyway, hopefully he'll be back in a second here. So. Are you guys hearing me okay? Somebody give me a thumbs up if they can hear me. Okay, so it must be on James's end. Anyway, so he's got, I've got, like I said, I've got this book, his Open Win. It's got a whole bunch of different topics on there. I thought it's interesting. I'm looking at. I'll ask him about it if we get him back on the different sort of protein options. Animal-based proteins, and I was just flipped to a page talking about beef protein isolate being more superior to whey protein, and the advantage he gives for it increases muscle hypertrophy and strength, increased fat loss, more balanced methionine glycine ratios, non-dairy for those allergic, better source of iron, vitamin B12, and a higher source of creatine. And so again, I didn't see the other things he lists in there, but he has some stuff that he talks about in here. So that might be an interesting topic if he comes back. We'll give just a second. So hopefully everyone is getting their questions answered. Like I said, I know a lot of questions are coming in right now. I'll try to get as many as I can on there. Oh, he's back. All right. James, let me find you. I got to unmute you again. Sorry. Where did he go? Oh, there you are. Okay, James, you have to unmute yourself again. Sorry.
Okay. Sorry about that. I lost connection.
Yeah. Okay. Anyway. Okay. Well, I'm going to ask a question because I was flipping open your book and it went to page 383 for those people that are interested, and it looks like you're comparing the different sort of protein powders and whatnot, and you've got a summary on beef protein compared to whey protein, and I've often heard whey protein being rated as very superior when it comes to amino acid composition. And if you look at things like the the DIAS and the PDCAS, amino acid, absorption studies. They look milk proteins tend to do very high, even above beef protein. But in this particular summary, you say that increased muscle hypertrophy and strength. I guess it's relative to whey protein, increased fat loss, better methionine glycine ratio, non-dairy, B12, higher source of creatine. Yeah. So again, do I need to take protein powder eating, 4 pounds of meat a day? Probably not. I think I've got adequate protein. But for those people that don't want to eat 4 pounds of meat, what do we got on for protein powder supplements? Or, and again, I would assume you would probably prefer whole food over isolates. But if we're going to do isolates, where are we at? What's best?
Yeah, the reason why beef protein seems to work so well is it's actually not mostly the meat, it's actually more so the collagen. So it's kind of a mixture between, let's say, like whey and collagen. It's like 80% collagen. So that's probably why you're seeing a little bit better in regarding to muscle thickness, like hypertrophy. Strength seems to be the same, like whey or beef protein, not going to matter in regards to strength, but actual hypertrophy, beef protein seems to be better, probably because there's some creatine there too.
Yeah, and you've probably seen the studies. There's been a couple of studies looking at whole egg versus egg white protein, whole milk versus skim milk, showing better muscle protein synthesis when you include the fats in there. And my assumption, at least what I'm seeing, is it might be due to the cholesterol. What are your thoughts on those having the fat incorporated with the protein?
Yeah, I mean, cholesterol is like the number one building block for many things. So yeah, I think cholesterol definitely is important for muscle protein synthesis for sure.
And then, let's put a different hat on from your sports scientist sort of thing back to your cardiovascular researcher. What's the 2022 story on cholesterol, serum cholesterol, dietary saturated fat? What are your thoughts around those things?
Yes, I think. Well, so I think most people think that dietary cholesterol will lead to high total cholesterol. Doesn't really work like that. I think the problem with, like, let's say saturated fat is only when you consume a moderate to high amount of carbs, refined carbs with it. That's the problem. When you're not consuming refined carbohydrates and sugars, saturated fats, cholesterol don't seem to have a problem because it doesn't have chronic insulin driving it and leading to all the problems. So context is important, and I know you know this stuff.
I do, but I like to hear other people say it, so I don't sound like the only crazy person in the room. No,
Right.
and I think that's a lot of the stuff we have this contextual base. And, I'm seeing these studies about TMAO and now the study about mitochondrial RNA. And it's like, well, what is the context with which the meat is being consumed in? Sure, if you've got a dysbiotic gut or you've got failing kidneys and you've got chronically inflamed gut, probably anything can be a problem there. And so when we don't have that context, we're not, I made this thing about Tom Brady and his vegan diet, which clearly it's not. He's actually eating more meat, fish, and eggs than the average American, but he's not eating junk food. And I think that's a very important caveat that we have to sort of realize that.
Yeah.
Just because anything else in the book that you want us to know about? I know you want people to read the book to get the whole story, but are there any other concepts that you talk about? You don't have to go into detail that affect our performance one way or another that most people are not thinking about.
Two concepts which are kind of similar is one is dehydration acclimation in regards to it's great to use salt solutions to acutely boost performance, but if you actually want to have better performance later on, then actually just drinking when you're thirsty will lead to mild dehydration. And then you do that multiple times, and the adaptations of that will improve performance later on. And then you rehydrate after that dehydration session. And in a similar fashion, utilizing sauna and inducing heat acclimation can also lead to benefits to performance later on.
Yeah, so I mean, just make it more difficult on yourself, basically. So I'm going to dehydrate myself so that when I do hydrate, I'm going to get a bigger performance boost. So it's kind of like a super compensation, I would assume. Is that kind of the sort of thought behind that?
Yeah, so the body adapts to dehydration or heat acclimation after a couple of weeks by expanding baseline blood volume, decreasing baseline core body temperature. So it takes you longer now to heat up or hit a critical core temperature. So you can actually exercise longer before your enzymes start shutting down from heat. Your sweat actually becomes more dilute, which is twofold benefit. One, you lose less electrolytes. Two, you can evaporate your sweat much faster when it's more dilute. So you're literally a better cooling off machine when you are dehydrated, acclimated, or heat acclimated.
So by doing that, by losing more water relative to solute, you're going to be, you're going to be a little concentrated in your blood, but if you get used to that. So I've got a question here. So I've got a sauna we just were able to get at the house. Do I need to throw a ice bath next to it and do contrast? Is that going to provide additional benefit, or what are your thoughts around mixing those two? And then your thoughts around cold. I mean, I've seen some negative about cold therapy coupled directly to exercise. Can cold therapy benefit us?
So depends on the exercise. If you're looking for muscle hypertrophy and strength, you do not want to jump into a cold bath afterwards because that will shut down the inflammation. And yes, you will recover faster, but you will decrease some of the gains that you would have gotten. But if you're in a training camp like UFC fighter and you need to train really hard the next day, then you definitely want to do a cold bath because that's going to shut down all the inflammation and it's going to increase power output better, even out to 96 hours afterwards, compared to not doing such. So yeah, I don't think you don't want to do cold right after sauna because you're inhibiting then some of the benefits. You still stay warm for a while, and heat shock proteins still stay elevated for a fairly long time after a sauna session. So might want to wait a little bit before actually doing like a cold bath.
Okay, because a lot of people they'll do sauna 10 minutes, hop in the ice bath for a minute, back and forth, back and forth. So you would say that probably is defeating the purpose.
Yeah, exactly. I think it sounds cool to do contrast therapy, but I think that actually it would inhibit some of the benefits that you would have gotten had you just not jumped in or waited 30 minutes before jumping in.
Yeah, and there's a comment from one of our guys, Steve, saying that with sauna he sees blood sugar elevation, with cold he sees the blood sugar drop. I mean, I think sauna is just similar to exercise. You get the same sort of response. We know that our liver has a tremendous capacity for glycogenolysis when we're exercising intently. Is that a valid? I mean, his observation is his observation. Is that consistent with what the literature might show?
Yep, exactly. So sauna is essentially mimicking exercise, whereas cold is shutting down and decreasing inflammation and things like that.
Let me ask you about this. I don't know if you covered in the book. I suspect you might, but I mean, you're probably familiar with Wim Hof and his Wim Hof breathing and his sort of kind of hyperventilating, to some degree. And I think what he's doing is he's probably driving pH up a little bit. Is that what's going on? What's going on? Is there any benefit to sort of altering our breathing? And then, I guess the other thing would be mouth versus nose breathing. There's some concern about people taping their mouth at night, or they're exercising, trying to breathe through their nose and through their mouth. What about the breathing side of things?
Yeah, I mean, trying to hyperventilate to offload more acid, I think it's better to just preload and get ahead of the problem with just like sodium citrate or sodium bicarbonate than trying to hyperventilate. I do think breathing through the nose though is definitely more beneficial because it's going to increase nitric oxide production compared to breathing through the mouth. So that makes more sense to me if you can do it.
And just for the people that aren't familiar, nitric oxide would have a beneficial effect on the vasculature, correct? Is that how we're seeing some vasodilation perhaps, or some increased compliance or something? What's going on with the nitric oxide rather?
Yeah, I mean, nitric oxide is a vasodilator, antiplatelet effects, thins the blood, antioxidant. So yeah, it has a lot of benefits. But at a certain point, you're not going to be able to breathe out of your nose. When you're going like at a certain point, when you're going hard enough, you have to breathe out of your mouth.
Just because of the amount of volume you're exchanging, right? I see like when I'm rolling really hard, my mouth's opening out.
Yeah.
It's like there's no way I'm doing that with my nose, and I've tried it. But what about sleeping? I mean, do you get into that? People taping their mouth shut when they sleep? Is that valid?
Yeah, I think it is valid. It's just again the same principle: nitric oxide, uh, antioxidant effects, things like that, cardiovascular benefits.
James, I got a couple of minutes. I want to give this time for you to tell people where to get the book. I think I'm actually, of the books you've written, this is the one that has the most interest to me, just for personal reasons. But thank you for writing it. I look forward to kind of picking through it. I've got a trip coming up where I'm going to pick it on the plane and probably read it entirety. But where do people go to find it? Tell us more about social media, more information, because you're putting out a lot of useful and helpful information for society in general, and I appreciate that. So let us know where to get this stuff.
Yep. So people can get Win on Amazon. It's in paperback or Kindle, and I'm most active typically on Instagram at Dr. James Dinek.
Gotcha. Perfect. All right. Well, thanks everybody. Thanks, James. Appreciate it. Good luck. When's the next book coming out? I'm sure you got another one in the works, probably. I don't know.
Yeah,
Anyway,
some I'll do something on obesity, I think, coming
that'd
up.
be good. That'd be good. Well, that's certainly, there's more people that are dealing with obesity than champion athletes. I can tell you that. That's for sure. So you have bigger options. But, all right. Thanks everybody. We'll see you tomorrow. Thanks, James. Have a great day. Good
You
luck.
too.
That's
Thanks.
all. Appreciate it. All right. Bye, everybody. Take care.
Bye.